Welcome to 2025, where we have a brand new illness that is sweeping across China and actually making its way into India and other parts of Asia at this time. Right now, the fear train seems to be rolling, where they have many different illnesses that the news and the media are trying to make us panic about. We have the bird flu, influenza, everything in between. But the one thing that makes this Chinese virus just a little bit different, or a lot different, is the fact that it seems to be overwhelming the hospitals in Asia right now as we speak. The media is trying to play it down a little bit, but I think that this is going to potentially be a lot more explosive than what it appears to be right now. And the reason being is, just like back in 2019, when the Event 201 happened to have taken place, we now have an event that took place back in 2022 talking about a new illness that would sweep across the world in 2025. But what makes this illness a little bit different is the fact that it seems to target children more than adults. Very similarly, so is this disease that is taking place in China as we speak. Let's get a little bit deeper into that right now.
I hate to say this, but it feels like 2020 all over again. Overflowing hospitals and thousands of patients with flu-like symptoms. China is facing a new health crisis, a new disease outbreak, which looks a lot like the Wuhan virus. And as always, Beijing is sharing no information. They're calling it a pneumonia of unknown origin. That's how Chinese authorities have described it. Beijing says it has set up systems to monitor the outbreak.
As per the information available so far, HMPV causes symptoms similar to influenza as well as COVID-19. However, unlike the two, it currently does not have any corresponding vaccine. How concerning is that?
We do hope it's just that, but sadly the pictures tell a different story. Take a look at this. This is believed to be from a hospital in China. We cannot verify these pictures, but several videos like this one are going viral. Clearly, there is more to the story. We do not wish to speculate and feed the fear, but here is what we know so far. This is not a new disease. Experts say that China is dealing with an outbreak of HMPV. That's the human metapneumovirus, HMPV. This virus has been around for at least 60 years. It is quite common and easy to catch. So unlike the Wuhan virus, this time they seem to be dealing with a known disease, and yet there are reasons to be worried. The first reason is the scale of the outbreak. It is massive. Cases have been reported in multiple cities across China: Beijing, Tianjin, Hebei, Shaanxi, and Inner Mongolia. These 5 areas have reported the highest number of cases. The second reason to be worried is the nature of the patients. HMPV attacks the younger sections of the population, the children and adolescents. They are the most vulnerable to contracting this virus, and a large number of patients right now are also children. Plus, the treatment is also challenging, because just like the Wuhan virus, the HMPV is a respiratory disease. There is no drug to treat it. There are no vaccines either. And the symptoms are similar. Fever, cold, cough, and shortness of breath. That's what HMPV patients have. In severe cases, they can develop other complications like bronchitis or pneumonia. So they may need intensive care, oxygen, or even a ventilator.
Now, the reason that I bring this up is not to cause you to fear. I'm not saying that this is the next pandemic. I'm just saying that there are some extremely striking similarities between what's happening right now and some of the predictive programming that we have seen over the past couple years. Specifically, the event that the Bill and Melinda Gates Foundation, in conjunction with the Johns Hopkins Medical Center, just happened to do back in 2022, that coincidentally mentioned a 2025 pandemic that killed over 20 million people, and it focused mainly on children.
Officials in 2 Latin American countries alerted the WHO of several outbreaks of a new infectious disease that's mysteriously appearing across the region. Severe Epidemic Enterovirus Respiratory Syndrome 2025. Over the past 6 weeks alone, there have been 500 confirmed or suspected cases reported. The virus could cause a severe pandemic if early containment and mitigation efforts are not successful.
The pandemic in this type of situation and trend would be a risk for the global health security.
Pandemics are inherently political, financial, and so much broader.
We have not spoken on the leadership in country. And I think that we need to be also very careful. We cannot decide a lot of things without the leaders be involved and agree on that.
There is no substitute for national leadership.
It's important to support the local response or the national response.
Training those that are in these areas first, enabling them with the tools, protecting them, and if needs be, regional solidarity first.
At this stage, communication is key, and communication should include not just scientists with data, but also social, religious, and political leaders.
Trust. This is an essential issue, and trust was broken among countries, between populations and healthcare systems, between healthcare systems and governments.
I'm very sorry to say that in 2025, we need to strengthen the health system.
WHO needs to be a voice for the voiceless.
No one is safe until all of us are safe.
As of today, there have been an estimated 1 billion cases worldwide, with more than 20 million deaths, including nearly 15 million children. Countless millions are alive, but left with paralysis or brain damage. The most successful countries are those which invested in preparedness and trained for this moment years in advance. This included having full-time pandemic preparedness and response teams, which conducted detailed operational planning and routinely tested those plans through exercises and drills. If more countries had participated and heeded the guidance, the toll might have been much less.
Now, this is not the only piece of quote-unquote predictive programming referring to a pandemic in 2025. Matter of fact, the Sci-Fi channel on YouTube, which used to be a Sci-Fi channel on television, happened to create a movie that referred to lockdowns in 2025 because of an illness that just so happens to strike children more than adults.
How do you think the world will end? If you knew the end of the world was here, would you be at home with your family? In the only safe place you know, or thought you knew? What if the real enemy was within the human heart? Your own heart.
Is this about the emergency broadcast?
Yeah, martial law, huh? We on lockdown, the whole country.
You've been warned. The day of truth is here.
You demon! You demon!
You know who doing this? What are you talking? You one of them?
It's never too late to change.
If this is all the time I have with my son, I'm gonna spend it with him right now.
Clarence!
Put the gun down!
And then every man's sword shall be against his brother.
What should we do?
I remember they'd always say one thing. It's coming.
In addition to all of this, they've been ringing warning bells all year long, especially since the flu and cold season started here in the wintertime. And they're trying to get people really worked up in fear because of any particular disease that might happen at that particular moment.
We have some
big picture stuff coming down the pike starting on January 21st. Mr. Bloomberg mentioned H5N1. That I'm really worried about. It's all over wild birds on the western part of the United States and going up in the north. It's getting into the poultry. We're seeing sporadic human cases, no human-to-human transmission yet, but that could happen. It's in the cattle, it's in the milk, and that's just the beginning. We have another major coronavirus likely brewing in Asia. We've had SARS in 2002, SARS-2, COVID-19 in 2019, and we know these viruses are jumping from bats to people thousands of times a year, but there's still more. We know that we have a big problem with mosquito-transmitted viruses all along the Gulf Coast, where I am here in Texas. So we're expecting dengue and possibly Zika virus coming back, or a Puche virus, maybe even yellow fever. And there's more.
The bird flu is getting a lot of attention right now, with some experts worried it could become a major public health risk.
Now the CDC also warns multiple viruses are surging. As Amy Kiley reports, the result could be a spike in related hospitalizations.
If you start developing any respiratory symptoms, you need to get tested.
The CDC is warning of surges in flu, RSV, norovirus, and COVID cases. It's now predicting respiratory virus hospitalizations could be as high as last year, despite a slow start to the cold and flu season.
Those of us in infectious disease always worry about influenza.
The CDC reports a 12% jump in positive flu tests in the week ending December 21st. It says more than 12,000 people were hospitalized with the flu then. Right now, health officials say influenza A is the biggest concern, but experts are sounding the alarm about bird flu.
There's a lot about the bird flu and how it's mutating that we don't know about.
There's not yet cases of human-to-human transmission. That can happen at any time. Once that begins, we are indeed in for another pandemic.
Norovirus is another issue. Many people call it stomach flu, although it's not a type of influenza or even a respiratory illness. The CDC reports an unusual spike in norovirus outbreaks this month.
We are also moving into RSV season, respiratory syncytial virus season.
Health officials say the number of RSV cases is high and is increasing in most areas of the country. And young children are especially at risk. They say COVID cases are on the rise too.
So, am I bringing this up to fear? No, this is not a video to cause you to fear. In fact, our Father in heaven says, "Fear not what man can do to the body, but fear him alone, which has the power to destroy both the body and the soul." But he also says, "My people perish for lack of knowledge." Now, when it's referring to the end times, it discusses explicitly that in those days there shall be pestilences, earthquakes, and many of this in diverse places. Not to mention, there's also the horsemen in Revelation that refers to pestilences being brought with him and the world succumbing to his efforts. Now, we have to remember here that if we are the fathers, if we have dedicated our lives to our Father in heaven and his Son, Yeshua HaMashiach, and in response to the salvation of him and his Son dying on that cross, that we follow his ways and we repent of the ways that we have once followed, we will be safe. We can get sick. We can be hurt. People can do whatever they want to us. But at the end of the day, our soul will be in our Father's hands, and we will be safe regardless of what happens to our bodies. I thank you so much for watching. Be safe, be blessed, and have a great day.